Hi, I'm Dr. Rajani. Thanks for joining me today. We got a great video in store. We're doing lip fillers today on a patient that you've seen already, had dysport done, had a cat eye lift. You can go back and watch them. Today we're doing the lip filler part. I'll talk you through that. You'll watch it. You'll hear within the clinic the conversations we're having, patient expectations, and we're going to use Restylane Kiss. Let's get started in 3 seconds. So remember, if you like the videos, click like, subscribe. Remember to click the bell, because if you do, you'll be reminded of the videos that are upcoming. And there's a search tool, so you can search within the channel anything you're interested in on skin, vertical lip lines. A lot of people ask about mesotherapy, ask about Ulthera, can you do a video? A lot of times they're already made. Just go into the search bar and you can see a picture of it here. You can type in what you want to see. Chances are there's a video, but we can always update and do a new one if you want. Let's pop into the clinic now. Okay, you've got to stop the mirror now. We're filming here. You can't keep looking at yourself. I know you like the look.
Made me look so good. I can't help it.
I'm gonna get the lip filler ready, and you can talk for a minute, entertain them. So, do you see the tail of the brow? You said you want it jacked up.
Yeah.
How is it?
No, it's
honestly,
amazing.
because some people would sit in the chair and they go, "Oh, I want a little more, a little less." But
yeah.
What I like about it is it's like a swoosh up. Mm-hmm. I like that look.
Yeah, I didn't expect to see like that much of a difference. Just like subtly, because I've done threads before. So your technique this time was crazy, because it just
I'm learning.
It went
all
woo.
the time. So that you
That
have
went
to,
up.
That means you have to help pay for my Asia trips, because that's what I learn. They do like stuff we don't even think about here, and I'm watching and I'm going, wow, I learn a lot over there.
Yeah, no,
So there you go.
I was really shocked.
You got to pay for my first class upgrade.
Yeah.
When you get your bill, you'll see. You will be paying for it.
Oh, God.
Okay, so now we're going to do a little lip filler. And this side here, this is really good for people to see too, because people come in, no one's symmetric. Yours is about as symmetric as they get, mainly because I've made you symmetric over time.
It's true.
That's how you compliment yourself. No, but you mentioned that this side sits a little lower.
My bottom, yeah.
Oh,
and some
the bottom.
little tunnel on the top. But I think we've mostly kind of fixed that over the years.
Close a little for me. And it's good to look at symmetry, and it's good to hear that. I start with the most difficult side first, and that way it's easier to match. So let's start with this side. And you want lip volume all the way through, or what do you imagine?
I do kind of like the pucker kiss look, but
See, this is interpreted for a regular street person. I like the pucker what?
like kiss, like the pucker and kiss look.
Okay, well that.
So like the top lip flipped up.
Got it. I understand
bottom
that.
lip flipped down.
Okay,
so
perfect.
Like,
so you want
like good volume, but.
And talk to us about the ratio, because a lot of people want a 50-50 lip, the top equal the bottom, 1.61 to 1, the golden ratio, where the top is a little smaller than the bottom.
Yeah.
What's going on out there right now, and what do you want?
I see a lot of like, top lips that are matching the bottom, which I think is pretty. I like my bottom lip to be a little bit bigger than my top lip.
Got it.
I do like a full top lip.
Yeah, because when I get up and speak in a conference and I talk about what I call the 50-50 lip, and I have a whole YouTube video on it that you may have seen, you should have seen, you should be a subscriber.
Oh yeah, no, I
hope.
watch your YouTube all the time.
Thank you, you better. And there's people that don't like that, and they're like, you know what? It should be golden, but they don't understand is you go to different countries, not everyone has that ratio.
Right.
You go to Asia, people don't have, and you're making lips, they start off 50-50. You know what I'm saying?
Yeah.
So African Americans, different shapes. So it doesn't have to be that way. Okay, so starting here, little poke coming. And you let me know how you're doing with it. So I'm using the tenting technique, pillar technique, whatever people call it. And a fun fact for you is we did this technique in the early 2000s with collagen. Do you know why?
Why?
You can't talk, right? You do have a needle in your lip, but we had collagen back then. And collagen, you think this stuff doesn't last because you come in every 6 months to a year. Collagen lasts about 6 weeks. So we did this technique with it. It was wonderful at the border. It was gorgeous.
Yeah.
And it was easy to work with. It was nice, Cosmoderm and Cosmoplast. But we did this technique with collagen because it's superficial and it tended to last longer in the face, intradermal, and in the lip, superficial. So this is what we did. You know how fads come? Like, do you wear bell bottoms and all that stuff anymore? Did that come back?
Yeah, I
Okay.
just got these jeans and they're so cute. I feel like for girls with like skinnier legs, they like look really cute. So not like huge bell bottoms, but I don't know, just like adds like.
See, it comes back in fashion, right? Well, that's what's happened with this lip filler. The techniques come back in fashion. And what I do, I know you want the vermilion border, and I know you're used to having it. Sorry, it's tender at the center. The other thing, when you flinch like that, though, I know I might be around a vessel, so I like it, because you know what travels with vessels are nerves. They travel together. Did you know that? It's kind of like boyfriend and girlfriend, but there's a third one there because there's arteries, veins, and nerves. The three of them travel together. So when people flinch, it's important for us as injectors. So that already flipped it up and looks good. I'm going to come to the bottom. And one of the things we have a conversation about, well, three things we have conversations about. Number one, Cupid's bow. Number two is central tubercle, because not everyone wants it. And number three is lateral lip. The rest, I pretty much do what I want. And then we have discussions about the other ones because that's the fashion of the lip. I guess you get out of fourth because we did talk about your need or your want for ratios, upper to bottom. So there's 4 things that I talk about, and there's 14 that I just do what I want type of thing. Mainly because anatomically and aesthetically, I don't want to do things that don't look good. You're my billboard. You know, my patients are my billboard, right?
Yeah.
So if I send them out looking the way I don't like, that's a bad billboard. Doing okay with the pain? Mm-hmm. So very superficial injections, not using a lot of product, to be honest. But nor do you need a big lip, and I know you want it, so don't freak out, but I did say you're my billboard, and I like, you have such perfect angles. We don't want to ruin too big of lips on a nice face with a narrow chin and a perfect V shape. Why detract from all those beautiful features with oversized lips?
Right.
You could do plasma lip and have an oversized lip for a while, and you can enjoy that, but that will help you with color. The size doesn't stay along, but you get to see what it might look like. Now, how's the pain with this technique, by the way?
It's not bad. The numbing cream works really well. So it's just like little pricks.
Now, I noticed the numbing cream works really well. You never hear, oh, my injector's doing such a great job.
No, that's
like
true.
the numbing cream.
Everyone knows you do an amazing
Oh my God! There's definitely nothing being thrown my way here. I should not do numbing cream then, so you'll see it's all doctor technique here.
It's true.
You say that as long as there's a needle in your face, and then you can say whatever you want, right? Mm-hmm. Always treat the injector well until it's over. Didn't have much for that one. So, what I'm doing, I'm kind of looking at symmetry. I'm looking at the border from the top. Always looking down the center. Anyone who evaluates a patient from the side isn't doing it right. You got to look down the center. And so, okay, because symmetry is important to people, right? I know we notice it. Some people notice it and some don't, but the majority of people come in, we want to make them more symmetric than not. Do you find your friends getting overly large lips? What's the trend now?
Depends on the person. I feel like for me, at first I wanted like really big lips because that was the trend like a couple years back. And it still is the trend, but like I'm starting to want more just like full lips. Like I don't want huge lips.
I like that too.
I want, like a full lip.
I like that too. To me, it detracts from the beauty And I think anyone can have what they want, for one. Like, I don't mind if people want a large lip, that's what they want, it floats their boat. It's okay, but personally, I find it detracts from beautiful features in the face, because all you see is lip. And kind of, unless someone has tiny lips, anyone can have just a big lip. It's a shapely lip and a proportionate lip. One of the things I talk about all the time on the channel is the lip to chin and the side profile ratio. Do you even ever look at yours, or is it something that people look at? Like, anytime I do a lip roller, the first thing I do is look from the side. I want the chin and the nose and the ski jump to be appropriate to age, cheek, and jawline.
Yeah, no, I think since like everything, especially with social media, is moving more towards video now as opposed to like photos.
Thank
people are
goodness, because I'm a
starting to pay more
YouTuber.
attention
You're
to
like,
it.
you're in my good books today for sure.
But if you look at TikTok, it's all videos, you know, so everyone wants a good like 3D, like all the way around face.
Right?
It's not just about like photos.
I know, the two-dimensional thing drives me crazy, and a lot of people with lip fillers obviously can look in 2 dimensions. I like that, girl. I like what I'm seeing. I need a little more on this side over here. So what I do with lip fillers is I kind of do and make it the way I want, that I think after our conversation. And at the very end, I always save a little bit of filler in case there's something that she wants slightly different, an asymmetry that she sees, or if she wants a Cupid's bow or something a little bit different, or a central tubercle. Now, we did a little more injections on this side, but you'll get a little more swelling on that side. But in general, let me evaluate you. So you got brows. When the dysport kicks in, that's going to be gorgeous too. That's going to help lift. We did your forehead, we did your frown, we did your chin, did your lips. We got a lip lift here. Have a look in the mirror. Now, this is like for an injector. You sit there and you go, oh my God, please like it, or don't, or what.
Oh my gosh.
All I want to hear is, I just want to hear a few words. I did better than Jamie. If I can hear those words, because no one knows Jamie's right here, and she's my rock star. Like I own her or something, but she does my treatments, and you can't say that in front of her. You know where your bread is buttered, as we say.
All I'm gonna say is you train.
Do they look? Well, Jamie might give me the sign of.
No, they look amazing.
Oh yeah.
They look okay.
I love it. Cause I like a border, so I feel like it brought that out.
So that's lip fillers, very popular. Let me know, what do you like? What products do you like? Have you had them done? Do you want them done? What did you like and didn't? Join me here. Keep your skin and body beautiful, healthy, and vibrant.